everyone, welcome to the Kernel series. Today we are going to discuss about antenatal fetal monitoring. As we've already dealt about prenatal screening, which involves most of the early trimester screening, let us see what we have to do in late trimester. The main objective here is to prevent intrauterine death and unnecessary interventions. So let us see how do we monitor the antenatal fetal well-being. Firstly, by clinical, secondly biophysical, and finally biochemical. Clinically, how do we see? The fetal movements, yes, Cardiff count of 10 or daily fetal movement count, DFMC. Cardiff count of 10 is where in a full day mother should appreciate at least 10 fetal movements. If she has any reduction in this, then she has to report to the hospital immediately. Secondly, daily fetal movement count. Here, after every meal, breakfast, lunch and dinner, for 1 hour she will monitor the fetal movements. That is, at least she should have 3 movements, which is multiplied by 4. And if it is less than 10, then she should come to the hospital immediately. Next, coming to the biophysical method. Biophysical methods are firstly non-stress test, that is your NST. What do you see? Baseline fetal heart rate, acceleration, variability, decelerations. If anything is there, you will count. Okay, about NST we will discuss in detail later. If there are uterine contractions, then it becomes cardiotocograph. Then ultrasonography, where you will do the obstetric scan for fetal well-being. Here you will look for biophysical profile. Remember, biophysical profile is frequently asked MCQs. The different components of ultrasound biophysical profile are the fetal respiratory movements, gross fetal movements, fetal tone and amniotic fluid. Along with that, NST becomes the 5th point. Each of them carry 2 points each and a total of 10 points. This is the biophysical profile. It is very tedious to do all of them when the fetus is sleeping. That is why they have modified it in case of emergencies. That is modified biophysical profile. What are the components of that? One is amniotic fluid index and the other is NST. There are only 2 components in modified biophysical profile, NST and amniotic fluid index. Amniotic fluid volume per se is a very good biophysical indicator of fetal well-being. Next, coming to the Doppler studies to assess the fetal well-being. You can do Doppler assessment of umbilical artery, middle cerebral artery, ductus venosus and umbilical vein to assess the fetal well-being. These are the common arteries where we perform Doppler studies. Finally, coming to the biochemical assessment of fetal well-being, it is an invasive test and it is mostly done to assess the fetal lung maturity. The amniotic fluid is collected to assess the fetal lung maturity. There are different tests to assess the amniotic fluid for the fetal lung maturity. You should know all of them by names because they are very frequently asked and very important in your exams. Normally at around 32 weeks, the lecithin sphingomyelin ratio is around 1, whereas at 35 weeks it becomes 2. Any value more than 2 says that the fetal lung is fully matured. Secondly, the shake test or the bubble test, where a serially diluted amniotic fluid is taken and you shake it for 15 seconds and you leave it alone and watch for next 15 minutes. So, if the bubble is stable and not broken for next 15 minutes, that means the lung maturity is sufficient enough. This is your shake bubble test, where you will shake it for 15 seconds and watch for next 15 minutes. Next, coming to the foam stability test, where the serially diluted amniotic fluid is shaken and the foam is tested for stability, and if the dilution is more than 47, that means the lungs are matured. Next, coming to phosphatidylcholine. If it is more than 500 nanogram, that means the lungs are matured. Also, presence of lamellar bodies. If it is more than 30,000 per milliliter, that means the lungs are matured. Also, you can see presence of phosphatidylglycerol. Next, coming to orange colored cells, where amniotic fluid is stained with 0.1% of Nile blue sulfate. That time you can see more than 50% of orange colored cells. It indicates that the fetal lung is well matured. Also, you can see amniotic fluid being turbid. Initially, it is very fluid. As it becomes term, the amniotic fluid will become very turbid because of the desquamated cells. Thank you for watching this session. I hope it was useful. Have a great day.